Good morning, everybody. We are getting started with our monthly webinar. Welcome here today to LT Senior Services, our monthly webinar, and the webinar today is on Medicare. We're just letting people enter into the room and make sure that they can hear us before we get started. We're so happy that you're here today on this beautiful fall day in Austin, Texas. We have a big group of people here. We're excited that you're all here on our October webinar. And we'll go ahead and get started. So my name is Cindy Cummings. I am one of the founders of LT Senior Services. And LT Senior Services is a nonprofit that's, their whole goal is to help seniors and their families navigate through life in the Lake Travis area. We have over 40 members, and we have several members here today that would like to just log on and say hello. And without further ado, I'm going to have those people come in. And I see Natalie is coming in. Natalie, do you want to allow, I think we have Karen and Anne and a couple other people like that who are here today from our membership from LT Senior Services. LT Senior Services is a nonprofit. We're a 501c3. And one of the things that we want to do is to help educate seniors and their families. So we do that via a webinar series, and we hold them monthly. And I see some of our members are coming in. I see their pictures. Hey, Ann, we'll have you go first. How are you doing?
Good, good. I'm so glad to be joining everybody this morning. So I love being a part of this organization. We do a lot of really good things for older adults. So I represent Be Well MD. Be Well MD is a medical practice specifically for seniors. Dr. Carlson, Mark Carlson, is our medical director. He founded Be Well MD about 7 years ago, and we are a concierge medical practice. So basically what that means is Dr. Carlson and our medical team go into the homes of our patients and provide medical care in the comfort of their living room, their kitchen, wherever is most convenient for our patients. Dr. Carlson is a board-certified geriatrician, really working on helping seniors live as independently and safely for as long as possible. So we basically do primary care services in the home, and we have relationships with a network of other home based services that we can bring other services into the home. So we basically serve as the hub, and then we coordinate everything else around the patient.
Excellent. It's like the old times where the doctor comes and visits you.
Yep,
He's not riding on a horse though, huh?
That's right. No, he actually, his medical assistant drives him to each of these appointments, and then his nurse joins remotely. And we also can do virtual visits too. So if patients say, yeah, you don't really need to come to my house today, but we can dial up and do just this kind of interaction with the doctor, we accommodate that.
Excellent. COVID really opened that up, didn't it?
Absolutely.
We're so lucky. So lucky. Yes.
Yeah.
You also have an ancillary business, don't you?
We are. Actually, we are starting that after the first of the year, and we're going to be starting to do medical trials, clinical trials. So Dr. Carlson's very much into learning what the latest and greatest is for supporting seniors as they age. So we're looking at clinical trials in dementia, Parkinson's, Alzheimer's, osteoporosis. And so we'll be launching those after the first of the year, and I'd love to be able to come back and talk to you about that as well.
Oh, that'd be fascinating. Well, Ann, thank you so much for checking in with us today. And you are one of our favorite members. You helped us to coordinate our flu shots for the Aging Well Expo, and we are so appreciative of that.
Wonderful.
So it's great to see you. See you next time.
You all have a great week.
Thank you. Hey, Karen, you want to come in and say hey?
Hi. How is everybody?
Awesome.
Thanks for having me again, and thanks for Cindy and Natalie for putting on these great events for the seniors in the community. We really appreciate it. So I am I work for the Lake Travis Community Library, which is in Lakeway. It's across from the police station. Well, the police station got built across from us, so The library is open, and we are still having Zoom events though. So if you are able to do this, you can still join us on Zoom. Also, book clubs are meeting on Zoom, and also we have a speakers forum. Morgan will be there this Thursday online with a professor from the LBJ school talking about COVID and global development. So that should be very interesting. And we encourage you all to sign up for our online newsletter. We have some other things that'll probably be happening later in the fall and this month. And so if you sign up on our online for our email newsletter, it goes out every Monday. We promote events like this and things that are happening on Zoom and any other announcements we have. And we have a bookstore. We have a used bookstore. We appreciate everybody's donations, and we encourage you all to go in and buy something and take it home. And you could even bring it back if you want and then take something else. It's always changing in there. We're getting great donations, so we really appreciate it.
Well, it's great seeing you, Karen, and always thank you so much for your partnership and helping to educate those in our community. We appreciate you working with us, and also for your marketing and helping get the word out about our events.
Well, thank you for everything you're doing.
See you next month.
See ya.
So one of the events that we have coming up is our Shred Day. It's going to be October 18th, and it will be held at Lakeway Aquatic Center, which is, gosh, how do you describe it? Anyway, if you're in Lakeway, you know where that is. So the Shred Day, it's free. We do ask for donations. It has turned out to be one of our biggest fundraisers, and we're able to use that money to help fund other events. So if you have any shredding that you'd like to have done, we know a lot of people extended their tax due date, and so October 15th is when it was due. So we figured people might have extra paper from that, or if you've moved. What's great about this system for shredding, it's extremely safe. We use a professional company. They come, they have these garbage cans. We put all the shredding in there. They lock up the cans, and then they take it offsite and they shred it. We do pay for this company to come and do it, but again, the donations always help pay for that, and we're super excited to have everybody come to our Shred Day. Of course, we're going to have a November webinar, and we'll know more about that webinar. We're actually kind of changing it up a little bit, but we should know better who's going to be speaking and what the topic will be. So we'll email you that as soon as we have that information. We do have our directories. It's the 2021 member directory. We have over 40 members in our nonprofit. And if you have not received a directory and you would like one mailed to you, you could let us know. You could either email back Natalie, and we'll pop one in the mail to you. What's good about this is it has a lot of resources. It lists all the churches in the area. It has all of our calendar of events, and then it has all of our members' contact information, phone numbers, and emails. So we just had our Aging Well Expo. It went awesome. We had over 100 people attend. We had people who were able to get their flu shots. We had great speakers. It was just a really fabulous event with lots of door prizes and gifts that were in our bags, gift bags. So that was super exciting. If you come to the Shred Day, we're going to give you a gift bag though. So again, I think without further ado, let's talk about tech tips real quick. We have down at the very bottom, it depends on if you have an Apple or a PC, or if you're on your iPad or your phone, but towards the bottom, you're going to see some of the information that you can reach. And so some of the information is chatting, and this is where we can see questions that you might have. So the format for our event is that we're going to have a speaker. We're going to introduce a speaker. He's going to speak. And then after he's done speaking, we will interject with any kind of questions and chats and things that you have. One of the chats right now is asking, isn't Shred Day on the 20th? I'm going to have Natalie check that and make sure that that is occurring on the 18th or 20th. I get my days mixed up. I wouldn't be surprised if I'm wrong. LaDonna, thank you so much for your information. So without further ado, I'd like to bring in our speaker. Our speaker today is Scott Gidley. It might take him just a second to come in, and while he's doing that, I'm going to pull up his bio so I can read that to you. Scott, welcome, welcome.
Scott is coming in via phone because of technical difficulties.
Oh, he is.
And also I can confirm Shred Day is the 20th, not the 18th.
Okay. So sorry. Well, Natalie, since you're on the phone, I don't see the bio here. If you wouldn't mind reading his bio real quickly, then we can get started.
Sure.
Okay.
Scott Gidley is the founder and president of Charitable Financial Partners. A longtime resident of Lakeway, Scott Gidley has actively supported our community by serving on boards and task force committees, by fundraising for scholarships, teacher grants, LTISD organizations, and youth sports, by volunteering with several local nonprofit organizations, and by coaching, refereeing, and umping LTYA sports. Scott's wife, Beth, is a banker with Independent Bank in Lakeway. His two daughters attended and graduated from LT High School, and both are now teachers. Scott enjoys the diverse lifestyle and opportunities of our Lakeway, Lake Travis communities, and he enjoys walking his granddogs in our beautiful parks. With over 30 years of experience in financial services, Scott Gidley is the founder and president of Charitable Financial Partners, a local financial firm that provides objective and independent Medicare insurance planning advice, as well as comprehensive wealth management services. Annually, Scott supports several local charitable organizations.
Welcome, Scott. I can't see you. I see you as a little gray little telephone on our screen here. But I think one of the most important things to change in your bio is that you are now a grandfather. Is that right? And you just unmute. You probably are on mute on your phone. So if you could just unmute, we'll be able to hear you.
Now can you hear me?
We can hear you fabulously. How is it, Grandpa?
Oh, good. Oh, being a grandparent is wonderful. But I wish I could figure out technology better.
Oh, it's okay. We're all here together
Yeah.
and just trying to figure it out together. We're just happy that you're here.
Okay.
I'm actually going to go.
Thank you.
We're just going to have you start talking. So you just go ahead and do what you need to do. And then I'll be here
Okay.
to ask you questions when you're done.
That's fine. And I'll preface this by stating my apologies. My daughter lives in McKinney, Texas, and my first grandchild was born on the 23rd. And my wife and I were up here for about 10 days. She stayed, and then I drove back to Austin last weekend, but then I drove back up here on Thursday because my daughter who gave birth celebrated her 35-year birthday on Saturday. So I'm up here. Unfortunately, last night there were a lot of high winds and tornado-like activity, and we cannot get the internet connection to work on my laptop or my wife's laptop or my son-in-law's computer, who is a techie. So I apologize that you can't see me by face, but hopefully you can hear me.
We can hear you great. And, you know, we're all just doing the best we can do, Scott. So.
Okay. Well, I want to
All
talk
right.
about 2022 Medicare updates. And I want to start it off by saying that these are anticipated, expected, projected, but they're not finalized yet. The trustees for Medicare for CMS have met and they have issued expected changes, but typically between October 15th to October 31st, they're finalized and they're actually put into force. So what I'm going to share with you, I expect to happen, but I can't say it's guaranteed to happen, but probably a 99% probability that it will. I shared with Natalie presentation sheets, and I don't know if she can share these with you or not. Natalie, can you do that?
We'll work
Yes,
on that
Scott, I
one.
have them pulled up. Yep.
Okay.
So just let me know which
Okay.
one you want me to show.
Well, I'm starting with Medicare today, and actually, I gave you three of them, I think. One was 2222 Medicare Updates, and the other one was a kind of a one-pager summarizing it, and then another one with annual notice of changes, a one-pager. So I'm not sure where we are on that because I can't see. So I'm just going to verbalize. And you know, Medicare today, we now have 66 million individuals in the U.S., and that's approximately 1 in 4 that are covered by Medicare. Of that 66 million, 29 million currently have enrolled in Medicare Advantage plans. Talk about original Medicare, just for the sake of simplicity. Original Medicare is Part A and Part B. And Part A is hospitalization, inpatient type of procedures, and Part B is outpatients and doctors. What we're going to see with Part A with original Medicare, It's free for those who have worked, or if your spouse has worked for 10 years or longer. The definition is really 40 quarters or more. And those don't need to be consecutive quarters. You could work for 2 or 3 years and then be off for 3 or 4 years and then work again. But as long as in your lifetime you've accumulated 40 quarters of paying payroll taxes and Social Security withholdings and Medicare taxes, your Part A will be free. If you have worked 30 to 39 quarters, your Part A premium will be $274 per month, which is an increase of $15. If you've worked fewer than 30 quarters, your Part A premium will cost you $499 per month, which is an increase of $18. Now, still looking at Part A, the hospitalization, the inpatient hospitalization, you have an annual deductible that applies to your Part A. This year, it's expected to go up to $1,556, which is an increase of $72. If you're in the hospital days 1 through 60, you still pay 0, so there's no change there. Hospitalization days 61 through 90, you'll be paying $389 a day, which is an increase of $18. Days 91 plus, that's going up by $36, and that's $778 per day. Skilled nursing is also available under Part A. Days 1 through 20, your cost is 0. Days 21 through 100, your cost is $389 per day, which is an increase of $9. And days 100 plus, well, there simply isn't coverage for skilled nursing facility. Now, original Medicare Part B, your updates there. Part B, again, is your outpatient procedures, seeing your doctors. That's going up by $10 per month. It was $148.50 last year, and it's going up to $158.50 per month this year. Now, this is for folks that are not dually eligible. That is, if you're dually eligible, Medicaid and Medicare eligible, that means that you might qualify for extra help. And if you do qualify for extra help with the state will pay for your Part B premium. So if you have any questions about that, you can contact me directly, but there are parameters there with regard to income level and asset holdings and certain assets you can have which don't count. But suffice it to say that probably most folks in Lakeway will be not dually eligible. They'll have asset levels and they'll have income levels above the qualifying barriers, if you will. Another thing to consider is income-related monthly adjustment amounts, and that's known by the acronym IRMAA, I-R-M-A-A. And what that basically says is if your income level is above a certain amount, you'll have to pay a surplus above what the standard premium is for your Part B. This year, the filing individual return, and what they do is they look at your tax return from 2 years ago, and that is in 2021, Social Security and Medicare will look at what was your adjusted gross income on your 2019 tax return. Likewise, in 2022, they'll look at what it was in 2020. 2023, they'll look at it what it was in 2021. So they take it right off your tax return. You do have an opportunity to appeal that. If you had a situation where you had a windfall profit that year, or you made a bunch of money from the sale of a piece of real estate, or if you've retired. I've had clients that were making $200,000-$300,000 a year, and they've retired, and their pension income and Social Security is much less. So they can file an appeal, and sometimes Social Security and Medicare will allow that, and they will eliminate the surplus premium that would be added to your Part B premium. But if you're looking at this graphic, if you file an individual return and your AGI, modified adjusted gross income, is less than $91,000 or less, your base monthly premium for Part B will be $158.50. If you file a joint return you just kind of double that. 91,000, it becomes 182,000 or less. It's 158.50. If you're filing individually and it's $91,001 to $114,000, and if you're filing joint, 182.1 to 228, your monthly premium is 221.90. And looking down further in this graphic, you can basically look at what, if you file a joint return, if you file an individual return, rather than reading all these off, you can see how you will fit into that grid. Certainly if you're making $500,000 or more, or $750,000 or more, the maximum you'll pay is $538.90 for your monthly premium for Part B. So be aware that you have that standard base amount. And again, based on your tax return from 2 years ago, your Part B premium may increase based on your income level. Now I talk a little bit about prescription drug plans, Part D updates. The annual deductible for your Part D prescription drugs will increase by $35 this year, going up to $480. Your initial coverage limit is going up by $300, which is now going to be $4,430. The coverage gap, which is also known as the donut hole, has become a little more simplified, and basically it's saying that your maximum out-of-pocket coverage gap is 25%, and that is the amount that you'll be paying for your prescription drugs will be 25% of the Medicare allowable amount. The out-of-pocket threshold is going up by $500 to $7,050, and your catastrophic coverage, which is once you get to $7,050 or more for your prescription drugs, they can't charge you more than $3.95 to $9.85, depending upon the classification of the drug, and that's up by 25 cents and 65 cents respectively. I guess I make another point in here that for those that are buying supplemental coverage beyond just your original Medicare Part A and Part B, it's expected that if you're buying a standalone prescription drug plan, those premiums are going to go up about $3 a month on average. The average being $31 a month, it's going to go up to about $34 a month. And likewise, with your Medicare Advantage plans, those actually are expected to go down with an average of about $21 or $22 in 2021. The average monthly premium for a Medicare Advantage is going to be about $19. You also have to be aware that there are those income-related monthly adjustment amounts, the IRMA, for prescription drug plans as well. And that is to say, again, looking at that grid, if your income level, whether you file individually or whether you file joint, you can look at the different number parameters there. Based on your income level, not only will you pay a surplus for your Part B premium, but also for your Part D, your prescription drug premium. Those can go up slightly as well too. And you can see they go up $12.30 for the first line, $31.80, $51.30, $70.70, $77.60. So again, if your income level is high, you will not only pay a premium for your Part B, a surplus on your Part B premium, you'll also pay an additional amount for your Part D prescription drug plans. And that's computed whether you buy a standalone Part D prescription drug plan, or if you buy a Medicare Advantage plan with a combination of a prescription drug plan with it, commonly known as an MAPD in our language. That premium will go up with the surplus required for your prescription drugs. Some other things to consider. Last year, the senior savings model was implemented, and that is Medicare decided that they were going to start making allowances for insulin and people that have diabetes. Last year, this program was implemented. Not every Medicare insurance company adopted it, but more are adopting it this year. Last year, it pertained only to standalone prescription drug plans. This year, it's not only expanding with some prescription drug plans with companies, but it also is being included in some Medicare Advantage plans. And those are going to be subject to the county that you live in, the state that you live in. It's going to vary. So it's not across the board. Some states, some counties will have the insulin savings program with their Medicare Advantage, and some will not. But essentially, it will allow you to purchase a month's supply of a wide range of insulins for no more than $35 copayment each. For those of you who maybe are diabetic or have family members who are diabetic, you probably know that the cost of insulin is very expensive. It can be several $100s to $700 to $800 to $900 to $1,000 per month. It will throw you into the coverage gap, the donut hole, pretty quickly, and you'll get to the end of the year where you're not paying more than $3 or $9 for it. But during the course of the year, until you get to that point, you'll spend thousands of dollars on your insulin. So the senior savings model, again, was implemented last year. It continues this year. It's expanding. It's expected to expand and be a part of Medicare going forward. The critical thing there, and I put, is if you're looking at a Medicare Advantage plan, you need to make sure that the insulin that you obtain is on the formulary or the list of drugs accepted by that insurance company. Some will accept some type, and some will accept others. And rather than get into the details in that, if you want to contact me and ask me whether your insulin is covered under a certain plan, I can help you with that. Medicare Advantage Part C updates. Now, Part C is basically a Medicare Advantage plan. You've got Part A and Part B with original Medicare, again, hospitalization and doctors. Your Part C is your Medicare Advantage plan. Your Part D is your prescription drug plan. This year, your highest maximum out-of-pocket limit is going to increase by $1,150 up to $8,700. And again, your maximum out-of-pockets will vary by plan. This is the maximum it can be. Some companies will have it be at that level. Some companies will have it be at a little lower than that. In 2022, we're also going to have a continuation of the end-stage renal disease, commonly referred to as ESRD. And that is to say that individuals with ESRD can enroll in Medicare Advantage plans. Last year also ALS was included. So those who were afflicted by ALS can also now get coverage, Medicare coverage under Medicare Advantage plans. And now to qualify for these, like I point out here with bullet points, you must be enrolled in Part A and Part B in order to obtain your Medicare Advantage plan and have the ASRD coverage. You must live in the plan service area, the county. In other words, where you buy your supplemental insurance, whether it's Medicare Advantage or a Medigap or Medicare supplement, you have to live in that plan service area. And if you've moved, then you need to notify your Medicare insurance company and let them know of your move so that your records reflect where you currently reside. And of course, it says here that you must be able to make an informed decision, which means you must still have cognitive abilities in order to make that decision. So I go to my final page here. I mean, we'll go to questions, but I also have a one-pager where I've tried to kind of synthesize all of my panels here, or all of my pages, into a one-pager. And I don't know if you can share that with them or not, Natalie, but basically Medicare beneficiaries can expect their premiums, their deductibles, and their cost-sharing amounts to change each calendar year. And what I've done here is a one-pager, and I'm just kind of addressing your premiums, your deductibles, and your cost-sharing. And this would just kind of try to simplify it on one page that you can go to as a reference point for what your charges will be.
Scott, we
and
have
I
it
guess
pulled up.
Yeah. Hello?
Scott, I have it pulled up for them. The sheet you're talking about, the 2022 Medicare updates?
Medicare updates, yeah, just that one pager.
Yes.
So that's just, I'm trying to take all of the pages that I took off of my PowerPoint presentation, if you will, to give people one pager if they want a cheat sheet. I would also like to point out that every year, if you have your Medicare Advantage plans, you should receive by September 30th an annual notice of change called ANOC, A-N-O-C. And basically, that will talk about your Medicare Advantage plans, or if you have a Part D prescription drug plan, that company will send you an annual notice, which provides you with really important information. It's going to talk about your coverage changes. It's going to talk about your provider network changes. It's going to talk about your drug list and pharmacy network changes. It's going to talk about cost changes. And rather than reading through all of this, I guess just to try to simplify that, purchasing supplemental, that is a Medicare Advantage or a Medicare Supplement Medigap plan, it's not just a one and done proposition. Every year, it's prudent to take a look at what coverage you have and take a look at your medical situation. You may have to go see some specialists that you didn't see last year. You may have moved to a different area. Are your doctors in network or are they out of network? Those are important things to consider, because if you're going to doctors that are out of network, it can cost quite a bit more than if you're going to doctors that are in network. So it's important to each year take a look at what's happened with my health, any changes. Am I seeing different doctors? Am I taking different prescriptions? There are cost changes that are going to occur every year too. And an independent Medicare agent will be representing numerous companies, and each year he or she can say, well, let's get the facts that you have this year as opposed to last year. Let's take a look at the prescription drugs you're taking. Certain companies will change their pricing. They'll change their classifications for drugs each year, whereas one year an insurance company may have a drug as a tier 2 drug, which might cost you $12 or $20 to purchase it. They may classify it as a tier 1 the next year, in which case you might pay $0 for it or $10. So on the other hand, sometimes drugs will fall off of formulary too. So it's very important to look at the prescription drugs you take every year and see how they're going to be priced next year on the plan that you're on. And if there's a change that's detrimental to you, that's when you need to look at, do I need to consider a different plan? There are numerous plans out there. There are probably 5 to 7 companies that will control about 95 to 97% of the market here in Travis County. And I think it's prudent really to take a look at the doctors you see, take a look at the prescriptions you take each year, and make sure that the plan you have is the best plan for you in terms of in-network, out-of-network situations, and in terms of the actual cost sharing, your deductibles that will pertain to your prescription drug plan, as well as your co-payments for the drugs that you take. So if you haven't received that notice, contact your Medicare insurance company. You should have received it by September 30th. It's still not too late to ask them for it. We're coming up right now into the annual enrollment period known as AEP, which goes from October 15th through December 7th. And that's the time when you can make changes to your Medicare insurance coverage. You can't just do it anytime that you want. You are limited to this time frame of October 15th to December 7th to make these changes. So that being said, I'm open for questions. Certainly you can reach out to me if you'd like to by phone or by email, or I'm happy to answer questions here. And I guess I would also add that I'm just now finishing and should be up and running tomorrow or the next day by October 15th, my new website, which is called MedicareLakeway.com. And on that, I'll be sharing with you a lot of information of the how-tos and whys and enrollment periods and eligibility and different types of Medicare plans. And it'll be interactive where you can ask questions and I'll respond to you promptly. That being said, yeah, thank you. And I'm open to answer any questions that I can.
Well, we've got a couple for you. The first is people are asking if we could send that sheet to them. Could we include that in our follow-up email, your one-sheeter for everybody?
You can send everything to them. That one sheeter, the Understanding Your Medicare Plan Annual Notice, I put together a one-pager there, which can give people an outline of things they need to pay attention to. And then I also had, about 8 or 9 or 10 pages, Natalie, which was, I think I just did it in Word as opposed to a PowerPoint presentation. But yeah, the answer is you can send them any of this stuff.
Perfect. We do a follow-up email normally about a day afterwards. And then we also talk about the fact that this will be posted on YouTube. So people, if they want to share it with other people who missed the event, we have a YouTube channel. We're just getting so fancy. So here's another question. How does original Medicare work or coordinate with a physician's concierge practice? Great question.
A physician's concierge practice is typically that white glove where you go and you see the doctor and there's more confidentiality to it. And I think that's what they're talking about. If that doctor...
we just introduced Be Well MD, and they're a concierge service. And so would concierge kind of services be covered under Medicare, do you think?
It's a function of the doctor. If the doctor in the clinic accepts Medicare, then yes. There are some doctors that will accept only original Medicare, which is A and B. There are some doctors will accept original Medicare and they will accept Medicare Advantage.
Okay, so that's
it really becomes a question of they need to contact Be Well or they need to contact the concierge, and have they arranged with Medicare to accept Medicare. Perfect. Or to accept Medicare Advantage. If they're working with a Medicare Advantage, which is a supplemental plan, they will need to contact the companies like Aetna or Blue Cross Blue Shield or Cigna or Humana or United Healthcare, and enter into contract with them in order to have their Medicare Advantage plan, to have the company accept the provider as a Medicare provider within their plan network. So I can't say yes automatically, but the provider itself, Be Well or other concierge, will need to either accept original Medicare or they will need to contract with these companies for Medicare Advantage. That's not automatic.
So we have another question. If I change supplemental policies and I have a pre-existing condition, will medical conditions after affect acceptance? This is from Advantage to another supplemental to a different company.
Medicare supplement plans, also known as Medigap, you have a guaranteed issue from the time that you are 65 years old till the time that you are 65 and 6 months. If you do not sign up for your Medigap during that time frame, or I should qualify that to say, if you're covered by your group health plan and you don't retire till you're 68, you still have that 6-month guaranteed issue possibility with your Medigap. But back to the question, if you have a Medigap plan and you get it when you're 65 to 6 months, then there's no medical underwriting. If you do not sign up for it and you're not covered by creditable coverage with a group plan, or if you have originally signed up with Medicare Advantage as opposed to a Medigap or Medicare Supplement, and let's say you're 65 and 9 months, your guaranteed issue period with the Medigap no longer exists, and you are subject to medical underwriting questions. And you can either be rated or you can be declined.
Okay.
Each company will have a little different set of questions, but by and large, it's, are you in a nursing home? Are you in assisted living? Do you need home health care? Have you had a heart attack? Major medical conditions could prevent you from getting issued on a Medicare supplement, also known as a Medigap plan, after that 6-month guarantee issue period.
So the real key here is to make sure that you get qualified with the insurance coverage that you want during the time that you're 65 up to 6 months.
That is correct, particularly if you want the Medigap or Medicare supplement and you're just turning 65 now, you can't get the Plan F anymore. You have to get a Plan G or another plan, whichever you choose. But Plan G now is the most comprehensive. It covers everything with the exception of not paying the Part B deductible, which is expected to be about $215 this year.
Okay. We have a comment from somebody. It says, the presenter referred to Medicare Advantage plan as a supplement, which might be a bit misleading. Could you elaborate on that?
I would say that we're getting into nomenclature there. You have original Part A and you have original Part B. And then if you read the Medicare language, it will say, then you can go ahead and you can buy supplemental insurance coverage to go on top of your Part A and Part B from private insurance companies. So the use of the term supplemental coverage is kind of a generic term, but then in the industry, a Medicare supplement plan is known as a Medigap plan and a Medicare supplement, and a Medicare Advantage Part C is known as a Part C Medicare Advantage, but technically both of them are supplemental to your Part A and your Part B original Medicare. So I didn't mean to confuse anyone by saying that. I mean, both of them are in addition to Part B, both of them supplement it, but I guess in the verbiage in the industry, there's Medicare Advantage, and then separately there's Medicare supplements.
Okay, well, this is a very confusing topic. It's probably one of the toughest topics each year that we cover just because it's complicated. So again, I think it's important for people to understand that they should meet with you and discuss their own personal situations so that they can better understand if they should make switches.
And I guess just to add to that, if maybe it's more clear, there's original Medicare Part A and Part B. And then you can choose to do just that. And if you do just original Medicare Part A and Part B, you'll be subject to that $1,500 plus deductible every time you go into the hospital. There's no maximum out-of-pocket limit. And when you go to the doctors, you got to pay roughly about 20% of all doctors' charges. Original Medicare will cover about 80% of that. So then you say, do I want to just have the original Medicare Part A or Part B? Or do I want to do something in addition to that to supplement A and B in order to try to reduce my cost sharing factors? That is deductibles and premiums and co-payments and co-insurance and stuff like that. So I was using the word to supplement as just kind of a generic concept. And I'm sorry if that was confusing, because separately, in the industry, if you go and you buy private insurance from the companies, in addition to your original Medicare, you have to choose among Medicare Advantage, a Part C plan, or a Medicare Supplement Plan G, or whatever plan you want to pursue. And the Medicare Supplement is also known as Medigap.
Okay.
So those are really two separate avenues to pursue beyond the original Medicare.
Great. We've got some more questions. If you travel or you have extended stays out of the state, you could or should not have an Advantage Medicare plan. Is that a true statement?
Well, I would say that you have to look at the Medicare Advantage plan you purchase. A lot of the Medicare Advantage plans will say that you have travel expense coverage. Some of the companies will say, like in 40 or 45 of the 50 states, there will be travel coverage allowed to you, and it will be treated as if you are in network. Some other Medicare Advantage plans do not have that travel benefit privilege. So that is one of the considerations you need to think about when you're making that decision of buying either a Medicare Advantage or a Medicare Supplement plan is, do you travel a lot? Do you have family in states that maybe a Medicare Advantage plan does not offer travel expense coverage or travel coverage? So that's why it's important if you're saying I don't want to take that risk, then a person should buy a Medigap or Medicare Supplement, because any doctor, any hospital, any clinic that accepts Medicare will accept your Medigap or Medicare Supplement plan. Some will not accept Medicare Advantage, and that's when you have the horror stories of someone traveling and they have to go see someone because they have an emergency, and suddenly they have to pay out-of-network expenses, and it's terribly expensive as opposed to paying in-network expenses. But there are some Medicare Advantage plans which allow for travel coverage. And you just need to identify which of those companies has it and which doesn't, and where you're going. Now, when I got clients that will ask me that, I just say, well, work with your agent, and I can go online to the various companies' websites, and I can punch in the zip code or the county where they will be traveling, and I will provide a list of hospitals, clinics, doctors, specialties, family doctors, cardiologists, endocrinologists, whatever the specialty is, and I'll provide my clients with a list of within a 5 or 10 mile radius of where you're going to be. Here's the list of all the providers that are in network. So if you do have an emergency situation, you should go to one of these providers as opposed to just going to a place without knowing whether they're in network or not. But so I hope that answers the question.
Yeah, I think it's probably something.
A lot of people will say, don't buy an Advantage plan because if you travel, it won't cover anything. Well, that's not necessarily true. You have to look at each individual company's plan and then look at their benefits, their summary of benefits, and some do and some don't.
Great. What is the financial incentive for agents to get someone to switch to an Advantage plan?
There is no financial advantage. As a licensed and certified Medicare agent, I receive a commission from the insurance company if I sell a Medicare Advantage plan. I receive the same commission if I sell a Medicare supplement plan. So it doesn't behoove me to switch them from a Medicare supplement to a Medicare Advantage or vice versa. I guess I would qualify that by saying some companies will say, we will pay you a commission for only an 8 or 10 year period if you provide someone with a Medicare supplement plan, after which you don't get a commission anymore. So I would say some unethical or some unscrupulous agents might try to flip people from Medicare supplement plans where they no longer receive a commission after 8 or 10 years and try to flip them to a Medicare Advantage plan to try to get a commission. But I'll say here unequivocally, I would never do that.
Great.
That to me is unethical, and that's not serving the client in their best interest.
Right. We do have a response from Anne Maloley, and she is a representative from Be Well MD. So let me just read what she said. Regarding the question about a physician's concierge practice, with Be Well MD, Medicare covers all of the typical services provided during visits and typically covers the ancillary services that Be Well MD coordinates with, such as lab services, diagnostics, physical therapy, home health, etc. Medicare does not cover the monthly fee that the patient pays for the home visits, which is considered premium for having 24/7 access and same-day service from our medical team. So I think that answers that pretty well.
Oh, good.
Yeah. Let me see if there's any other questions. I'm just going to our other chat just to see if I got anything. If I have anything in there. I do not see anything there. Scott, is there any final words that you'd like to say to everybody who has participated today in the webinar?
Well, I guess maybe just to reiterate a point I made earlier, be smart about your Medicare insurance planning. Don't just sign up when you're 65 or when you've retired and assume that what you have will be with you for the rest of your life and is the best thing you can get. Things change, doctors change, prescription drugs change, your health changes. Just like you go to the doctor once a year for an annual checkup, just like you take your automobile in once a year for a tune-up, it's worth spending maybe 15 minutes at least, if not an hour or so every year, to review your Medicare insurance and make sure that what you have is in your best interest and is the best thing that you can get.
Excellent. Thank you so much, Scott. We will include your contact information in our follow-up email with your phone number. And do you have a new website address? If you'll give that to Natalie, we'll include that.
Okay. Well, it's www.medicarelakeway.com.
Okay, excellent. Medicare.com.
Okay.
You got it. Thank you, Scott, so much, and congratulations again. If you were live, we would ask you to go take a screenshot of that little baby so we could see her. It's a girl, right?
No, it's a boy.
It's a boy. How fun.
They named him Harvey Bronson Morris.
Oh, what a great name. Well, he's going to do great things with that name.
Yeah. Well, thank you so much for the opportunity to share. If you have any questions, feel free to reach out to me. Cindy, you know me well enough that the approach I take is educational. I don't like to wear the hat of a salesperson. I'm not here to try to twist anyone's arms. I want to work with people in a consultative manner to help them understand what their options are and to try to help them understand what is the best decision for them. I'm also an independent, so I represent numerous companies. I'm not beholden to any company. I'm not going to shove any company's product down anyone's throat. I really am going to serve the client in their best interest. So that's just how I do business.
Thank you, Scott. That's one of the reasons why we have you come and talk every October, because we trust that you're going to provide the best services for our seniors. Okay, everyone.
Thank you.
For coming. We'll see you next month. We'll have more information about what that topic will be in the speaker in the coming week. Hope to see you at Shred Day, October 20th. Talk to you all later. Bye-bye.
Thank you.